Welcome to Integrity Linguistics Institute. Third question. The guidelines on chemical waste disposal stress the need for staff to. Answer option A. Take appropriate safety precautions when handling chemicals. B. Ensure that any chemicals in the hospital are properly documented. C. Consult service providers before disposing of all hazardous chemicals. All right, so the third question, as well as the answer options, are given over here, translated for you, as well as in Hindi as well. Now, let's do the keyword analysis of the question. The guidelines on chemical waste disposal stress the need for staff to. Answer option A. Take appropriate safety precautions when handling chemicals. Okay, so safety precautions and chemicals. These are the keywords over here. Now, let's combine answer option A to the question and understand what it is telling us. The guidelines for chemical waste disposal emphasize the importance of staff taking safety precautions when dealing with chemicals. B option. Ensure that any chemicals in the hospital are properly documented. So what does that mean? The guidelines for chemical waste disposal emphasize the importance of staff ensuring proper documentation for all hospital chemicals. C option. Consult service providers before disposing of all hazardous chemicals. Okay, so these are the keywords over here. Now, understanding them together, the guidelines for chemical waste disposal highlight the importance of staff consulting service providers before disposing of any hazardous chemicals. Now, let's read the text. Unknown and empty chemical waste container disposal. Unlabeled chemicals are increasingly difficult and very costly to dispose of and may require special analysis in order to identify them. Furthermore, the hospital's chemical waste contractor will now not remove any unknown chemicals due to their risk level. Every effort should therefore be made to ensure that all chemicals in use, in storage, or being prepared for disposal are fully labeled and described. If unidentified waste is discovered, you should immediately notify the hospital's designated waste contractor via the help desk and complete an incident form. All empty containers which have previously contained chemicals for licensed disposal must be considered as hazardous waste until cleaned. Now let's understand that in simpler English. Disposing of unlabeled and empty chemical waste. Getting rid of chemicals with no labels is getting harder and costly. It might even need special testing to figure out what they are. Also, the hospital's waste contractor won't take any unknown chemicals because they are too risky. Wait. So, it is crucial to make sure that all chemicals in use, in storage, or getting ready to be thrown out have clear labels and descriptions. If you find waste that you cannot identify, let the hospital's waste contractor know right away and fill out an incident form. Empty containers that once held chemicals for safe disposal should be treated as hazardous waste until they are cleaned. Okay, so that is what the paragraph essentially is telling us in simple English. All right, so now you may go through these points that has been translated for better understanding. Now, let's come to find what the answer is to the third question. The question is this: the guidelines on chemical waste disposal stress the need for staff to. The correct answer option is B. Ensure that any chemicals in the hospital are properly documented. Now, let's understand why answer option B is the correct answer. The answer, ensure that any chemicals in the hospital are properly documented, is justified by the paragraph's emphasis on the importance of labeling and describing chemicals to avoid difficulties and costs associated with disposal. The paragraph explicitly states that every effort should be made to ensure that all chemicals in use, in storage, or being prepared for disposal are fully labeled and described. This is crucial to prevent the challenges of dealing with unlabeled or unidentified chemicals, which can be costly and may require special analysis for identification. Therefore, the guidelines stress the need for staff to properly document and label all chemicals in the hospital to facilitate safe and efficient chemical waste disposal. So, for these reasons, B is the correct answer option. Okay, so having made that understood to you, you may now go through the translations if at all, if it is needed. All right, so now let's understand why answer option A is eliminated. A option, take appropriate safety precautions when handling chemicals. This answer is incorrect because the text primarily emphasizes the need for proper labeling and documentation of chemicals in use or being prepared for disposal. While the text does discuss disposal and the need to notify the waste contractor in case of unidentified waste, the primary focus is on ensuring chemicals are labeled and described correctly. Safety precautions are essential but are not the central point of these guidelines. Okay, so for that particular reason, answer option A is eliminated. All right, so now let's go and understand why C answer option is wrong. Consult service providers before disposing of all hazardous chemicals. This answer is incorrect because the text does not specifically mention the need to consult service providers before disposing of hazardous chemicals. It does advise notifying the hospital's designated waste contractor and completing an incident form in case of unidentified waste. However, the primary emphasis is on proper labeling and documentation of chemicals to avoid the need for special analysis or removal issues due to unidentified chemicals. Okay, so that is the reason why C answer option is also the incorrect